What emotions do family carers go through when thinking about new arrangements for their loved ones?
I think a lot of the time families go through certainly the emotion of guilt when looking for care or care establishments for their family member. I think this is predominantly because they've spent so long taking such good care of their family member at home and are very concerned that a lot of care facilities may not be able to live up to their standard. And quite often guilt's certainly a big part of that, of emotions, and lots of other emotions, so the emotions of detachment and people leaving the family home, and obviously I think the emotion of losing someone as well. I think although it's not a loss within the family, I think people often think of it as a loss, and that's obviously very difficult to deal with.
And what can family carers do to help themselves and their loved ones prepare for the change in living arrangements?
I think my advice would certainly be to seek advice themselves from external professionals, so GPs, district nurse teams, social services and funding bodies. Continuing healthcare is a very good support body as well. I think just to obtain as much information as possible so that they can make the right decision for them their family member and their family.
So the transition into care can be quite difficult for people with dementia. So what advice would you give to help that transition process?
Well, we certainly advise here at Stockshall for taster days. We invite lots of people here for lunch, for teas, for trips out. I think that's imperative. I think it's very, very important that families make the right choice of care home for that person, that individual. And I think that needs to incorporate activities, the home environment. Is it the right environment for that person? Who the staff are as well, what interests the staff have. All these little things are really key, I think, in making sure that they're finding the right placement. But we would certainly advise for people to come certainly have a look around, come for a cup of tea and a chat, and do that several times before moving into a care home.
How do you find people with dementia cope with the change?
Sometimes very well, sometimes not so well. From my experience, I actually think people with dementia cope very well, a lot more than families expect or actually realise themselves. And this is because most good care facilities have the ability to be able to look after residents and help with that transition. For example, they may have experienced carers who are allocated specifically for new arrivals. There are activities and tailor-made things going on in care homes that help people settle in. So I actually think most people do settle into care fairly well. It's families that sometimes don't always expect that and expect the worst and expect people to be very confused or very upset with not living in a family home. And a good example of that is I think we have to live where they think they are. We have to be where they think they are. Just as an example, we had a lady who lived here who thought she was in one of her villas in Spain, and we used to go with that every day. We also thought we were in a villa in Spain as well, and we have to adapt to where they think they are as well. And if they don't think they are in a care home, we have to go along with that to help them make them feel settled, essentially.
How do you help carers then, if most of the issue seems to be with carers?
Yeah.
And their perception of coming into care? How can a care environment help carers cope with that change?
I think training is essential. I think training with regards to understanding dementia and understanding the differences between the different dementias is very important because they're also very different. And understanding the value of person-centred care as well. Everybody is different with dementia. And I think they're the fundamental issues that need to be addressed prior to a carer starting to work with people with dementia. And everyone's different, and I think that's the most important thing to understand.
And a lot of carers will ask the question, when's the right time to move into residential care?
There is no right or wrong time, as we tell a lot of people. However, we go and assess a lot of people in their own homes, so we see it from a different angle where family members may be struggling. I think it's important, like I said earlier, that they seek professional guidance throughout that time, throughout that dementia journey with their family member, to make sure that they're advised by people when is the right time.
And the financial aspect can be quite an issue for
Yes.
people and families. They're very concerned about the financial cost of moving into long term. Do you give advice to families about that?
Well, when it comes to financial matters in care, it's important that families are aware of the family members' financial position and how long they're able to fund care for. Lots of different care homes have different rates, and it's important that they're able to fund their stay in care for a prolonged period of time, and they're not just thinking about the here and now. And that happens quite a lot. And each care home has different facilities and therefore charges different rates. And it's important that they look at what's important in care homes. Is it the staff? Is it the facilities? Is it how it looks? Is it activities? In order to make those decisions as well. Obviously, there's lots and lots of support out there for families with regards to financial help in care. And it's important that they do their research as well with regards to what people are entitled to, when eligibility criteria kick in, and that's very important. And we'd always advise families, and we often do that here because we're quite knowledgeable on that subject.
So what organisations can they go to for that kind of advice?
So the first step is we'd advise people to go to social services. So people have to be below £23,500 threshold in order to obtain social services funded care. The next step after that is continuing healthcare funding. And a lot of families have this misconception that people are always entitled to continuing healthcare funding. And it's important that they read the criteria and checklist with regards to that, just to make sure there's no disappointment and to make sure that they're not fighting a battle that they're going to lose, essentially, and to take on board the advice from clinical services with regards to that person's clinical needs as well. So to help their loved one settle into a care home facility, it's a very difficult question to answer, and we get asked this question an awful lot. And again, there is no right or wrong answer. Some family members like to take a step back and to give people time to settle into accommodation, and some people prefer to come every day and increase the amount of visits. We would, from a professional point of view, we'd advise to balance it out and to have a happy medium with regard to that, and keep contact and keep that familiar face, and obviously people enjoy visits from family members, and to carry that forward whilst giving people time to settle down and also get to know other people and be accustomed to their surroundings.
And with regards to respite care and day centres, is that something that can have a positive effect on people with dementia?
With regards to respite care and day care, this works fantastically well in care, in my opinion. We facilitate a lot of respite and day care for residents here, and it helps them give a taster of potentially what could be. And it also, a lot of older people certainly have this perception of care homes as these horrible dingy places where people get put in their older years. However, I think just tasting that for a couple of weeks at a time to give families a break also helps people understand that care facilities are far from that, most of them. And actually we have people here come for holidays and for 2 weeks holidays. And it's also important to give families breaks as well and understand how much benefit that has for the families as well.
Have you come across any disadvantages to that for people with dementia?
The only disadvantages, if I'm honest, that we've encountered here at Stockshall is when people want to go home, and that isn't being entirely honest. We've had difficulties because people have settled in so well and families want to obviously take their loved one home. They found it very difficult to actually withdraw themselves from all what's going on here, which it's a very positive thing, but the families are hit with that decision then and feel like they're almost taking their loved one away from something they're enjoying. So personally here we haven't experienced any problems. However, in the past, and I'm sure in lots of places, depending on the level of dementia, I think if someone has if someone's on the latter scale of dementia, I think coming into respite is possibly not as positive, as adapting to a different setting may take quite some time. So it's more positive for people with lower needs with regard to their dementia and possibly early stages. Coming into care, with regards to daycare, I know a lot of care facilities have started to do this, and certainly we do at Stockshall here. And I really do think that's a concept that all care homes should adopt, because we have the staff here, we're open anyway. I think just to give that facility for someone, enable that facility for someone to come here for a day and actually experience the day in the life of a care home and be able to go home to their own home at night, I think is quite unique, and I think it's something that most care homes should look at doing, because it's a happy medium as well. It's allowing someone to participate and socialise and have a taste of potentially what could be, while still going home to their family and loved ones for night time. Recruitment's a key aspect of providing good quality care within a care home. It's essential that when we recruit staff, we take the time to interview people correctly and to get to know that person. They could be the best interviewer and answer the best questions. However, it's about who they are as a person. Do they have the right values? Do they have the right ethos towards care and the correct attitude towards what they're doing every day? Are they willing to learn and adapt, which is very important when working with people with dementia? Obviously, when people start to work, obviously training is very, very important with regards to understanding the different types of dementia and how everyone could be so different. Obviously, care planning and actually spending many months and years writing care plans to ensure they're very person-centred and to ensure that carers are following what's in place. But ultimately, it's between the relationship between the resident and the carer that's very important, and for the resident to build up trust with the staff member themselves and to build those relationships, to become a family, to become a friend of that person is really important in care. If I was asked for advice about selecting the right care home for someone with dementia, I would advise family members to ensure that they take time in looking at several different care facilities, making sure that they look at staffing levels within the home, they look at the cleanliness, the facilities, and most importantly, how the staff interact with the residents. I would always suggest it's a good idea to come at meal times if the care home allows that to happen. It's a very good way of looking at how staff interact at meal times, how they're assisting residents with meals if they need to. Also, ask about what meaningful activities are on each day and ask about why they've decided to structure those activities as part of the care home and as part of the care as to what that home does. And also look at the environment and look at the colours on the walls, how it's decorated. Has time been put into that to really think about people with dementia? There's a great phrase in care which we tell and we try and teach our staff every day. In fact, it's up on posters all around our care home, and that is, they don't live in our work, we work in their home.